Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. Note the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medications to be administered. Consider the appropriateness of the medication for the patient. Perform hand hygiene. Prepare medications for one patient at a time. Read the MAR and select the proper medication from the patient's medication drawer or unit stock. Compare the label of the medication administration record. Check expiration dates and perform calculations if necessary. When all medication for one have been prepared, recheck the label with the MAR before taking them to the patient, and return the medication stock to patient's drawer. Transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Ensure that the patient receives the medication at the correct time. Identify the patient. Usually, the patient should be identified using two methods. Compare information with the MAR. Check the name of the patient's identification band, and if the patient cannot identify him or herself, verify the patient's identification to the significant other. Complete necessary assessments before administering medications. Check allergy bracelet or ask patient about allergies. Explain the purpose and action of each medication to the patient. Perform hand hygiene and put on gloves. Use non-sterile gloves unless the skin is broken, then apply sterile gloves. Wash, rinse, and dry the affected area with water and clean gauze. If skin is very dry and flaking, apply topical medication while the skin is still damp. Change gloves and perform hand hygiene in between. Use sterile gloves for open skin lesions. Place required amount of medication using a cotton tip applicator. Note the cotton tip applicator is sterile and is for single use. Let the patient know that initial application may feel cold. Apply medication using one stroke and observe the inner to outer application. Observe signs of irritation or redness, and then perform hand hygiene. Then finally, document the procedure in the patient's chart.